Hi guys, Toby here with the Physio Studio with the third and final video in our series on sciatica, where we're going to begin talking about treatment. So ways you can begin to treat this, or ways that your doctor or physiotherapist may go about treating this pain. So first of all, we're going to go right back to the start and talk about what sciatica is. So as we've defined, it's pain along the backside of the leg that is caused by an irritation to the nerve roots in your spine. So, as we said, there are a number of ways this can happen. A disc could be pressing on that nerve. There could be a narrowing of the spinal cord or the spinal cord canal. Or there could be an issue with any of these joints above or below that are pressing onto that nerve. Now, on a healthy nerve, we can have any one of these issues and not have any pain. That may be a bit odd to hear, but it's normal to have these kinds of things like bulging discs or little defects with the joints and have absolutely no pain at all. Even healthy people will often show up like this on an MRI scan. When we have an issue is if there's already a bit of inflammation on that nerve root. So the nerve root has to already be sensitized for any of these things to cause an issue. This explains a little more how things like exercise or injections can help with that pain without actually changing how your back looks on the inside. So first of all, exercise. And as a physiotherapist, this is where I'm going to be the most knowledgeable here on how to use this to treat your pain. So in fact, first of all, the most effective exercise for a sciatica is non-specific. So that means walking, swimming, cycling, whatever form of aerobic exercise gets the lungs going, gets the heart going, that you enjoy is going to be the most effective form of treatment here. Now again, let pain be your guide. Don't go hell for leather from the beginning, because you may just end up irritating that nerve and having the complete opposite effect to what we want. Let the pain guide you, but go gently. A little bit of pain doing these things is normal, and we want to start to teach your body that this is a normal sensation and this is something that will go away given time. The reason this works, as I've discussed, aerobic exercise, or exercise that gets the lungs and heart going, decreases inflammation. So it can desensitize that nerve and essentially get the nerve to ignore any of those problems going on around it. The second thing that may help is more specific exercises. So for these, you will want to go to a physiotherapist or a doctor to begin these, but you can start out as simple as just practicing letting your back move a little bit. So whether that be lying on your back, dropping your knees from side to side, again, only going as far as pain allows, whether that be lying on your back, bringing your knees gently into your chest. Now again, let pain guide you. If the pain is coming on too severe, back off a little bit. Or whether that be practicing moving your spine in both directions. So coming onto your hands and knees like this, practicing arching your back and rounding your back. So similar to when we're doing our other forms of exercise, this is just introducing those normal movements to your back to begin getting you moving normally again, to allow that nerve to calm down and not be so irritated by these things around it. The other forms of treatment that you may opt to use would be injections and surgery. So an injection wouldn't usually be our first port of call. If you find exercise and specific exercises like these given by a physiotherapist aren't settling your pain, they will opt to send you for an injection. And as I've discussed, the way this works is going to decrease the inflammation around that nerve, hence allowing it to ignore the things around it. Finally, the most drastic option here is surgery. Now this will always be a last resort, and I would always recommend you complete a course of exercise rehab, first of all, to see can that settle your pain before looking to surgery. And it's important you make this decision in conjunction with your physiotherapist, with your doctor. A surgeon will go in and they will remove the offending things around that joint. So whether that be a piece of disc, whether that be an issue with the joints, they will go in and physically repair what is around there. This is not always 100% successful, but nor are the other forms of treatment. That's why this is always going to be a last resort. So again, this is not going to be the first port of call. You will always try the other forms first to see can they settle your pain, as they're much less drastic and much easier to do. I hope this video series was educational. I hope you learned a thing or two, and I hope it hopefully made that pain a bit less scary. Again, if you've any issues at all, contact us here at the clinic or give us a call. Okay?